Hi, everyone. Thank you so much for joining us as we discuss the Masters of Applied Science in Humanitarian Health at the Johns Hopkins Bloomberg School of Public Health. My name is Megan Mingie. I'm one of the admissions officers here. So I work with potential applicants to help answer their questions about the program, help connect them with the application process. And then joining me tonight, we have Paul and Court. So Paul, I'll let you introduce yourself first.
Hi, everyone. My name is Paul Spiegel. I'm a professor of practice at Johns Hopkins School of Bloomberg School of Public Health, as well as the director of the Center for Humanitarian Health, which is a center that combines the schools of medicine, nursing, and the School of Public Health, and concentrates on teaching, research in humanitarian emergencies. And then finally, I'm also the program director of the Masters of Applied Science in Humanitarian Health.
Thanks. And Court, could you tell us a little bit about yourself?
Sure. Greetings all. I'm Court Robinson, Associate Professor in the Department of International Health and Deputy Program Director for the Masters of Applied Science in Humanitarian Health, also core faculty with Center for Humanitarian Health. That's a lot of humanitarian health words. And I think, like Paul, we may get into this later, have a background not just in academics and research on humanitarian health issues, but also as a practitioner, worked for many years with Save the Children refugee programs in Thailand, U.S. Committee for Refugees promoting resettlement in the United States. So I think both of us bring both academic and, if you will, real-world practice in this area of humanitarian health.
Great, thank you both so much. So I'm going to go through the agenda, but I do want to share for our attendees tonight, there's a questions feature that you should have on your webinar dashboard. You can use that feature to submit your questions throughout the presentation. So if you see something that piques your interest, feel free to go ahead and submit your question. We'll gather those for the end of the presentation. And at that time, I'll be able to pass those questions along to Paul and Court, who can help to answer them for you. So don't hesitate to go ahead and submit those. And with that, I do want to tell you a little bit about the flow of our evening. So Paul is going to share some details on the humanitarian health industry, as well as our specific program within the Center for Humanitarian Health. He'll talk through the curriculum for the online program, as well as what it's like to be a student in an online program at Johns Hopkins School of Public Health. He'll talk through the multidisciplinary faculty that we have and some of their experience in the field, as Court mentioned. And then we'll also share some tuition, financial aid, and scholarship details, as well as the application process. And then, of course, we have that time at the end for Q&A. So, Paul, I will send it over to you to talk through the industry.
Okay, thank you. Good evening, everyone, and thanks for those that are joining on a Friday night. Perhaps this is not always the best time to have these meetings, but we're thrilled that you're able to join us. So, natural disasters, conflict, changes in poverty and movement and migration have left millions of people in need of humanitarian assistance. As of last year, it's now over 72 million people, actually, that are now displaced in some form or another, that are forcibly displaced. This means refugees, what a lot of people are familiar with, which are people that have crossed a border, but also there are many, nearly double as many people who are internally displaced within their own countries, as well as a lot of people that we don't even know the numbers, that are affected by conflict, but actually are still living in their houses. Needless to say, I'm sure you all are reading the papers in terms of Venezuela, Syria, Iraq, even Lebanon at this point. There's a lot of uncertainty in this world, and migration, and particularly forced migration, is on the rise. And this number of over 72 million now is the largest since at least World War II. Some say ever, but we don't have the numbers forever. So this the Masters of Applied Science in Humanitarian Health looks at the broad public health efforts to address these events. And by public health, we mean broad. We're looking at not just health, but prevention, nutrition, water sanitation and hygiene, but just as importantly, the political science components of it, the human rights components. We talk also about anthropology. This is a subject, conflict and natural disasters, that requires a broad lens and not simply looking solely at a health lens. However, health is our main focus, but we certainly go broader than that. So we look at the health of the populations, and looking at what's really important is to the integration of various tools and interventions to try to help people access quality care. And so, for example, if we don't look at community outreach and education of populations, then how they are going to reach these services, and if they don't know what their rights are in terms of accessing these services, then the level of quality, the level of access, and ultimately likely the quality will be problematic. Next slide, please. So the Johns Hopkins Center for Humanitarian Health, as I mentioned, it's composed of 3 schools: the School of Medicine, School of Public Health, where Court and I are based, and the School of Nursing. While I'm speaking, please read the vision. We are approximately 50 faculty across the 3 schools who are affiliated with the center. And these vary across the board, from nurses to PhDs to doctors to engineers. It's quite multidisciplinary. And our vision is to pursue new knowledge and disseminate this to save lives and reduce suffering. Maybe I should mention that there's a lot of different terminology, but when we talk about humanitarian emergencies and disasters, we're primarily referring to conflict-related disasters as well as natural disasters. But the third component that we talk about, but we really don't delve into detail, are technological disasters such as Chernobyl, nuclear disasters. Next slide, please. So the center has 3 broad objectives, which hopefully you would assume in a big academic university. So number 1 is research, which I'll get into. Number 2 is education and training, and they're really not in a particular order. And the third one, which is interesting, we think is interesting, is empowerment, which also includes advocacy. And I'll talk a little bit about each of these. So number 1, we are undertaking innovative research in this field. It's a difficult field to undertake research in because it's constantly changing. Access changes. How we do research in a place like Yemen, which is very unstable, is quite different than how we may do research and the methods that we use in a place like Kakuma refugee camp in Kenya, which is much more stable. So, in fact, Court teaches with another professor, Shannon Ducey, teaches a course that they're doing right now related to methods and measurement on this particular topic. And the research is far-flung. We have 50, as I mentioned, approximately 50 faculty. You can go onto our website and you're able to see who our faculty are, as well as our associates and affiliates. A lot of it relates to health systems research, looking at ways that we can integrate, for example, people that are displaced into existing national health systems. And then each of us have an area where where we delve further. So I'm sure Cortland will talk about this, but he works a lot in areas of sex trafficking. He works a lot in areas related to North Korea. And many more. But as an example, some of the areas that I'm quite interested in are innovative humanitarian financing. And then all of us, though, do some sort of health systems work, often some sort of monitoring, evaluation, and another area, big area, broad area, is surveillance and methods. Educating and training, we have across the board, we have, of course, our Masters of Public Health, our Masters of Science in Public Health, MSPH. we have PhDs, we have doctors of public health. Many of those are in person at our school, and we also have various online programs. When we do it for our internal program, our MPH and MSPHs, we do have a concentration and a certificate, both of which Court leads in humanitarian health. And we generally have approximately between 25 to 35 students per year. And we now have, as of last school year was our first time, we have now the Masters of Applied Science in Humanitarian Health, which is this program. It is, well, I'll go into a little bit more detail about what this program will entail, but we also then have a lot of other programs. We have couple week-long trainings twice a year called the HELP course, which is the health emergency in large populations. We also train within many countries. We train governments, NGOs, foundations, etc. It really depends on what our projects are. Empowering individuals is very important for obvious reasons, but in part of this now, and given a lot of the issues, the anti-migration and anti-refugee sentiment that has been increasing in the populism throughout the world, we have more and more been applying our evidence and evidence-based practices to try to work with governments, in some cases the US government, in other cases different governments, to try to use evidence to dispel many of the myths of the anti-migration, anti-refugee movements. And we also use much of our research to try to influence policy. But again, we try to be nonpartisan, but rather let the evidence speak for itself. Next slide, please. So it's constantly changing, as you can imagine, because our lives are often grants, and which grants we get, and then how it changes, and then when a grant is over. But as of, I think it was 3 months ago, we have 41 projects in 27 countries. These are just the Center for Humanitarian Health. The school is of course much bigger. 28% in all of these projects, we ask the researchers to say what is your principal subject or topic, and then secondary topics. But what I'm reporting here are just the principal topics. So 28% are health systems, 17% human rights, and then 16% mental health. We do have it's a smallish, but it's still relative to everyone else, a large group of mental health professionals that look at low income, middle income, and humanitarian emergencies. It's small relative to the 50. I think there are 7 of them, but it's one of the largest groups in this, looking at conflict in this area. And you can see where we are doing our various research. Next slide, please. So humanitarian health, ultimately our goal is to work with mid-professionals. Some of you may be new professionals or professionals that are not necessarily directly involved in humanitarian health, but have had some experience. And ultimately our goal, particularly for the Masters of Applied Science, and I guess we'll underline applied, means that we are really hoping to prepare you to be able to work in the field, in the humanitarian arena. So graduates will gain the necessary tools to be able to adapt and adopt to a rapidly changing environment. It's quite extraordinary. Some of my lectures, because my background has been in the United Nations, and I do some lectures every year about coordination and how coordination works. And what's extraordinary is even how that is changing constantly. So if you're looking for a dynamic and evolving field in humanitarian emergencies, this is it. And there is a strong interdisciplinary focus, as I mentioned early on. We cannot, and this is one of the nice things about the Masters of Applied Science, at least the 2 cohorts that we have thus far, is they're from a wide range of disciplines. And even though, of course, our focus will be on broad public health, we really need insights from people whose focus may not be that, or has not been that in the past. And so the interdisciplinary component is hugely important. Similarly, we have different approaches. So we may attack a problem from a quantitative, and Hopkins is known to be a strong quantitative school in epi and biostats, but we for the most part do a lot of mixed methods. So we have to do qualitative and quantitative, particularly because in such an evolving situation, things change, and we have to change our approaches according to how things move. The curriculum examines the importance of determinants of health, and this includes issues related to broad medical care, medical services, public health, mental health, personal behaviors. When you look at it's always been evident in terms of personal behaviors and culture, but when you look at even just the last year or so with the Ebola outbreak in DRC, the science behind now how we're treating and how we're vaccinating for Ebola has improved dramatically since the West African Ebola outbreak. But personal behaviors, concerns about governments, and distrust amongst the government and people that are outside an area that has had many problems for decades has been one of the major factors. And so behavioral change and communication is essential, for example. And then we need to look at a broad range of the social, environmental, and economic factors. We have a growing group within our Department of International Health who are health economists trying to look in this area, and it's an area we'd like to continue to move forward in. Next slide, please. So what are some of the careers? There are many. This program will provide the applicable skills for health practitioners, and it may be across the board. So I think a lot of people think about humanitarian health and humanitarian emergencies and concentrate on the emergency phase because that's what gets the media and that's obviously what gets the attention. But it is much, much more than that. And in fact, in many situations, the emergency phase is only one component, and we have to look at the whole emergency cycle, and that looks at everything from preparedness to response to post-disaster and management. So there is a lot for everyone to do, and there are a lot of people work on policies. Some of the more clinical folks will consider more on some of the responses and more of the curative or prevention. The whole disaster preparedness and recovery is a massive area that often doesn't get enough attention and certainly doesn't get enough money, which means that the disasters themselves are worse because we haven't done sufficient preparedness, or we have done poor recovery so that we haven't taken care of a lot of the precipitating factors that will cause an emergency to come again. And sadly, you will see that even though there are new emergencies all the time, there are many, many countries such as Somalia, DRC, Afghanistan, to name a few, that have been in a fragile and emergency situation for decades and decades. And unfortunately, there are about 10 or so different countries that constitute the majority of people that are affected or displaced by conflict. So there is and remains a high demand for managers and leaders in this field, and we've listed possible. I see the slide doesn't have all of them here, but certainly one of the largest numbers of organizations are NGOs that need competent people in this field. So NGOs can vary from Doctors Without Borders, Médecins Sans Frontières, the International Rescue Committee, Save the Children, CARE, you name it. There are thousands and thousands, and we also hope that we have people who are not living in America that are applying to this program. And as more and more countries develop their civil society, there are a lot of national NGOs as well. Of course, the Red Cross, Red Crescent movements. There are United Nations agencies. As I mentioned, I was with the UN. I was with UNHCR, the High Commissioner for Refugees, for about 12 to 13 years before coming back to Hopkins, which is my alma mater. There are then, if in the US, but also in Europe and now in Africa, there are broad centers for disease control. So people, of course, in the US will know CDC, but there's the European CDC, there's the African CDC, and there are more and more of these types of organizations, often government, parts of their government, and they need people that graduates from this sort of area. Think tanks and policy organizations across the board. You're aware of, many of you will be aware of Brookings Institute, the CSIS, Center for Strategic International Studies. There are many organizations such as that. There are also, I can't see what's below there, but there are also multilateral organizations such as the World Bank, Asian Development Bank, as well. So there's a wide variety of groups out there. I would say students often say, well, if I have not had experience, but have just had this degree, how easy is it to get a job in these places? And I would say that's often the crux of the question, is how do students get their foot in the door when they've undertaken this course, but have never worked in a humanitarian emergency. And that's where I think issues related to either internships or taking advantage of a situation where there's a big emergency and they need people who either speak the language, have certain skills that they need. For example, at one point they were looking for a lot of epidemiologists to go to work in DRC for the Ebola or for a cholera outbreak in Yemen. And that's one of the big areas, and I think those that have had previous experience often will have a slight leg up, but there are other ways also, including what you've done in the past, your languages, your cultures, etc. Next slide. I think I'm over to you now, is that right? Or, oh no, do I do this still? I can do this, yes, no I do. So the Masters of Applied Science and Humanitarian Health, 49 credits. There is a professional development component. There are many courses, and we will go over them shortly. And at the end, there's something called an integrative activity, which is similar to a capstone that many of you may have heard about in the past. The idea in court, and we'll go over this perhaps in more detail, but the integrative activity is meant to be able to have an activity that takes into account much of what you've learned throughout the previous year and 3 quarters. It's a 4-credit activity that you start before actually the last term, but it's meant to use everything and that you've learned to be able to apply it and then present it. There's definitely a skill-based orientation for working professionals. It's a part-time, but it's 100% online. Some people, if they are working but take all of the credits, are able to finish in 2 years, and others take a longer time, and that's fine as well. One pays per credit, and I think our colleagues will go into some of that. We do a mixture of group learning, peer assessment. We have been pedagogically innovating a lot, I would say, and so the courses are we work together with our Training and Learning Center for Training and Learning. They're very professionally done, and they're updated every year to make sure that we try to use the latest information. And it primarily focuses on understanding and leading the humanitarian health programs to ultimately improve health within and across populations. Next slide. So this is sort of the overview. When you look so this is year 1 and year 2, and then we have our terms 1, 2, 3, and 4, and the terms are usually approximately 8 weeks long. And you can look, for example, we'll go over each of these. I'll just read them out, and then you can ask some questions at the end. I don't want to take too long, so I want to make sure there's time for questions. So we have academic and research ethics, which is a required course that you don't get credit for. The first course that I lead on, I teach on this one, is Public Health and Humanitarian Emergencies. although we have much of the faculty that do guest lectures for this, and it really is meant to be an introduction of the whole field, everything from protection and human rights to post-disaster to coordination. Then we move on to a course that Cortland and Shannon Ducey are teaching now, which, oh, I'm sorry, that's the third one. So yeah, designing and planning of primary healthcare projects, and that is together with Gilbert Burnham. Sorry, it switched around. Cortland is doing another one in the second term. We do disaster preparedness, which is a focus on both conflict and epidemics and deals with international health regulations. And all students that take the Masters of Applied Science have to do, and it's a very important course, an introduction to EPI. We then do a water and sanitation and humanitarian emergencies, because you can't really concentrate on and want to improve the health of populations in humanitarian emergencies without knowing about WASH. We then do statistical concepts in public health, and then we look at social and cultural basis for community and primary health programs, again, because we need to be looking well beyond just health centers and hospitals and into the community. The next one that I was thinking about that Cortland and Shannon do is the assessment approaches in humanitarian emergencies, which concentrates on the methods and surveillance and how we do these in these complex environments, because we cannot do them in the same way as stable environments. Then we look at health needs and service provision in humanitarian emergencies. This one is more health and health care and service provision concentrated. Like with WASH, we need the nutrition and food security. It's essential in humanitarian emergencies. So Shannon Ducey teaches this one. And then this is a new course that we're in the midst of teaching now, which I'm very happy about. It's called Leadership and Management in Humanitarian Settings, because in many schools, and certainly when I was being taught these, we didn't look enough about we didn't examine management and leadership sufficiently. I think we concentrate a lot more on the technical components. And I think we've all seen probably in our lives that someone who can be very strong technically may not always be the best manager or leader. And while this course will not make you the best manager and leader, it will expose you to different methods and models and give examples of different ways of managing and leading in humanitarian settings. We have ethics and global health practice. We have then, and Cortland is teaching this one, the human rights and humanitarian emergencies. Humanitarian emergencies, the issues of ethics, human rights, protection, security are paramount. And so we need to know, we need to be exposed to this. We have a professional development workshop, Writing for Results. It is good that we're teaching some of the technical and then the softer skills, but we need also to be strong writers to be able to get when we're writing policy, to be able to be convincing. Finally, we have the last two is on the fourth term of the second year, non-governmental organizations and administration of global health programs. The majority of work throughout the world in humanitarian emergencies is undertaken either by governments and by NGOs, the non-governmental organizations. And so we have to have a strong idea of how they function in the health world. And then what you can not see very well is the integrative activity, which is what I mentioned previously. There are 4 credits. Next slide. Okay. I'm just trying to see, do I do this one, Megan, or are you doing this one?
I'm happy to jump in if you like.
Sure. Actually, no, I can do just a little bit on this. Hopkins was one of the earliest schools to get in to online learning, and not just with this, but we also have numerous programs on Coursera, which is a massive online course as well. So we've had many years to be able to do this, and as I mentioned, we've been constantly innovating to make the lectures that we provide to students who are online both both interesting, but also we try to cater to you because many, as I mentioned, are mid-career professionals, and so we usually do them in 15 to 20-minute pieces so that people can, they're very clear, and you can stop and you can do this over time, or you can do all at once if you want, but we're trying to make it much more for adult learning. And we have a whole Center for Training and Learning, CTL it's called, that works with us to make sure. We actually, they help us from everything from our slides, from how we record. They make us sound better. We don't say ah and oops in our when we're talking. They'll move those. So it is a high design value, a high design product, highly designed that hopefully will keep you engaged. And all of these, because they're recorded in 15 to 20-minute pieces, will provide flexibility for you. And then maybe over to Megan, particularly with the help desk and some other slides.
Sure, thanks, Paul. So absolutely appreciate your input on the how the courses are designed, and that is something we hear a lot from our current students. That they really just appreciate the caliber of learning that they get to engage with in an online environment. And like Paul mentioned, we do offer 24/7 technical help. So we have people who are ready and able to assist with login hiccups. Maybe you're just having trouble accessing the platform. We have a dedicated support line there to help. And Paul, I'll pass it back over to you to go over student assessment as well as the integrative activity.
Sure. So there are multiple ways that we do our assessments. And again, we recognize this is, many people are not early 20s doing this, but many are mid-career, and some are younger, but there are also some that are mid-career who don't have the same sort of time. And we're not interested in tricky questions, for example. We're really just interested in, has the student understood the broad areas that we're trying to get across? And so we do a mixture depending on the class. So some we do multiple choice questions and quizzes still. We often have to my knowledge, nearly every course will have some sort of, except for maybe the 1 credits, but the 2 credits, 3 credits, and 4 credits generally will have some sort of assignments. We're never looking for 20 or 30 pages of an assignment at this point. It's really more a question with a specific context, whether it be an acute phase, long phase, protracted, whether it be middle income or low income. We're trying to make sure that you understand the complexities of the humanitarian health response. And so usually they may vary between 3, 5, 10 pages. And we're not looking for prose, we're looking for understanding. In terms of, we generally will have, and it varies on the professor, but not generally, we'll always have some sort of live talks, which is actually something like what we're doing today, where we will either be discussing an assignment, discussing a specific lecture. Sometimes we bring in guest lecturers. We make sure, Court and I also make sure that we have some live talks that are not necessarily part of the courses, but are part of the Masters of Applied Science in Humanitarian Health cohort, so that we can talk about how the courses are going, what people are thinking, and also any ways that we can improve, and also to try to clarify any responses. And then we have discussion forums, and because this is online, we found these discussion forums to be very, very important. And many courses, I do this, is there's usually a small percentage of participation, and that requires making sure that people are on live talks, but just like this discussion now, we will be taping it, because not everyone, we have people from all over the world, so the time zone may not be to everyone's advantage, so we record them. We use a software called Course Plus, so we're able to clearly see who participates in the live talks, and so we're able to track student participation. And in the discussion forum, generally, It varies, but some of the students are quite active. In most of my courses, I actually have usually a question a week that relates to the lecture, but often also to a current event, and we like to interact with students. There are definitely, depending on, for example, problem-solving exercises when we're doing some of the epi and biostats and some of the methods courses, there may be some that are more problem-solving, while others may be shorter essays. Next slide. The integrative activity is the final term, as we showed you, 4 credits. It's really meant to draw on everything that you've learned thus far. It is so it can vary, and Court and I are working on this now, where we have been giving examples to students, and it can be everything from a broad literature review to a policy paper to potentially a grant. Someone wants to learn how to write a grant, and they want to be able to either use something real or a past grant, but they want to be able to have the practice to be able to do this, because grant writing is so important in this area. I think I mentioned policy brief, and it can be an evaluation as well. So someone can either look at past evaluations or use something that they're working on now. What we are not able to do, and this has come up numerous times, is for those students that want to undertake a study and need IRB, an ethical review process. This gets very complicated for students, because we need to have a professor. The rules are that a professor has to be part of this, and this can get very complicated, and we can get bogged down in some of the administrative issues. But what we have done for those that are numerically inclined is we have a bunch of open access databases that people are allowed to use to try to be able to use some of their epi or biostat skills if they so desire. And then Court, myself, or some of the faculty will be working with everyone on this, and we don't leave it to the last term. We start and we have directions or examples and requests for your second year, in your first term, your second term, and your third term, to start preparing for this integrative activity ahead of time, and we give you feedback. And we're in the midst of doing that right now with our first cohort is on their second year. Next slide, please. So this is some of our faculty. You have a look here. What I would suggest, though, is also the Center for Humanitarian Health. We have on our site, we have faculty with photos and a much more detailed biography. But you'll see we have a mixture of doctors, MPHs, MDs. We have some JDs. Len Rubenstein is a lawyer that used to work for Physicians for Human Rights. And maybe not shown here, but we also have many DRPHs. Furthermore, we have a lot of, for example, guest lecturers. So the WASH course, for example, what we did is we worked with experts in WASH, at UNICEF, at Oxfam, UNHCR, and various other NGOs throughout the world, to ask them to speak about some of their real life experiences. Next slide. Okay, I think that's over to you, Megan.
Well, so I'm sure some of you may have heard before about the scholarships that we offer, but I wanted to go into detail on those just in case you haven't. So the online programs here that the MAS in Humanitarian Health is situated within are called OPAL programs, so Online Programs for Applied Learning. And we offer a scholarship for all of those programs with a $446 per credit hour scholarship. So the tuition is a little over $1,100 per credit hour. For each credit hour, you're reducing that OPAL scholarship amount. In addition, we have 2 $10,000 scholarships offered through the Center for Humanitarian Health, and those are specifically for applicants from low and middle income countries. So the OPAL scholarship is available to every candidate in the program. That Center for Humanitarian Health additional funding is given to 2 incoming candidates each year. And both of those are dispersed over the length of the program. So as you're taking, say, 6 credits in a term, that particular percentage of these scholarships is applied to your tuition bill as well. So to be eligible for those scholarships, you must meet all admissions requirements and be admitted to the program. And then specifically for the 2 $10,000 scholarships, you would need to reside in a lower middle income country. If you're not sure if your country is within that bracket, we're happy to help answer that via the questions feature. You can also look in the World Bank list that's available online to see a list of those countries. In addition, you must submit all of your application materials by May 15th. So that's a little earlier than our usual application deadline. That gives the center some extra time to review your candidacy and select candidates who kind of meet what they're looking for in terms of that additional funding. So like I mentioned, the tuition at its current rate is $1,162 per credit hour with that $446 per credit scholarship. So those rates are reassessed each year. We usually do that in the spring. So, as you're moving through the application process, you would learn about that updated tuition rate if it does change. The great news about both of our scholarships, the OPAL and the Center for Humanitarian Health scholarships, is that your admissions application also serves as your scholarship application. So you don't need to submit any additional documentation. In addition, if you are considering how to fund the program and would like more information on financial aid, we've provided that contact information here. So many of our students use a combination of the scholarship, perhaps federal financial aid. Many have tuition reimbursement that's available through their jobs. So that's definitely something to explore for you as well. And then some candidates pay out of pocket as well. So many choose a mix of some of those methods, and we're happy to help direct you to the right point of contact if you have questions about funding. And then to explain the application process a little bit, we use a portal called SOFIS. It's a common application portal, so you would log in through our website and be able to choose the program that you're interested in. All of our candidates are required to have a bachelor's degree from an accredited college or university. So if you're in the United States, you would have the bachelor's degree listed on your transcript. If you're abroad and you're not sure whether your degree is equivalent, you can definitely check with our team and we can provide some initial information, or you would look into a credential evaluation process to find that out. In addition, we require a minimum of 2 years of work experience in the public health field. I'm sure Paul will have some questions about that at the end, so we'll save those for you. Many candidates often ask what kind of work qualifies for public health work experience. And there are a few different kind of avenues where people gain experience before coming to our program. In addition, we require a current resume or CV, as well as 3 letters of recommendation. Those letters would be professional and or academic sources. We also ask for a statement of purpose that demonstrates why you feel that you're a good fit for our program, what excites you about this program, what do you hope to do with the program in the future, maybe how your current work experience ties in with what you'll be learning, or perhaps you're looking for kind of a change of work direction and why this degree is the right fit to get you there. So that statement is one of the most important application components. It's very valuable for our admissions committee to be able to learn more about you, get to know you, and make sure that this is the right fit for you. So definitely take your time writing that statement and feel free to reach out to us if you have questions about it. And then finally, if you are a candidate who has an international background, so someone who may have citizenship outside of the U.S. or studied abroad as well, then you would need to prove your proficiency in English via the TOEFL or the IELTS proficiency exam. And then we also require international academic records to be evaluated by a credential evaluating service. We use WES primarily, the World Education Services portal. Many of you may already be familiar with WES. that is something that we encourage you to get started on now, because it can take a little while to provide them with your documentation and get everything moving through the credential evaluation process. So we are accepting applications now for our fall 2020 start. We review applications on a rolling basis. So the earlier you apply, the earlier you will receive an admissions decision. We do have a priority deadline that is on April 15th of 2020. So I know that sounds kind of far away, but like I mentioned, especially if you've got international educational backgrounds, it can take a while to get all of your documents in. So we always recommend starting that process as soon as possible. And then if you are from a low and middle income country and are eligible to apply for that CHH funding, the $10,000 scholarship, then your final application deadline would be May 15th. And then if you are not applying for that CHH scholarship and you don't make everything in by the priority deadline, then your deadline to apply would be June 1st of 2020. And all of that leads up to our start date, which is August 31st of 2020. So we've been getting some great questions coming in. We're always happy to see that. And at this time, I'll loop in both Paul and Court. So our first question coming in, can I complete this while I'm working in the field?
Court, why don't you go ahead?
Yeah, I think absolutely. This is why the program is designed as it is. It's online, it's part-time. It teaches you things that we think you'll need to advance a career in humanitarian health, and it also, particularly in the integrative activity, allows you to build on work that you're doing or build toward work that you hope to be doing, even if it's in a related field. So yes, absolutely. Keep your job, stay in the field, and complete the degree. And we'll work out connectivity issues as we go, depending on where you are.
Yeah, I would just add that absolutely. In fact, we have many, many people that are doing this in the field. It may, depending on where you are and the amount of work, you may not be able to do it in 2 years, but that also just depends on the feasibility of the work and that you're doing and the workload.
Thank you. And that is a great point. Some of our candidates do move through the program in that 2-year format, and others take more time to complete. So we have a student services team that works with our students to plan out the curriculum, when it makes the most sense. So combining the schedule when courses are offered with your own personal needs and schedule to make sure that you have a quality experience and have the time to dedicate as well. We had someone ask to move back to the last slide, so I'm going to change the slides, but we will put up the contact information again in just a couple of minutes. So another question that came in was, how many students per year receive the OPAL scholarship? That scholarship is actually not capped. So as many students as are admitted to the program and begin the program, that OPAL scholarship is awarded. So we're very happy to be able to offer that to our students to help offset the cost of your tuition and reach a broader audience. So that is available to everyone. Court, another question that came in, are there networking opportunities within the program?
I would say yes. I mean, we are just beginning the second year of the first cohort. So it's early days, but we know that students are actively engaged in discussing with us in a course related content and format, as well as in live talks and discussions that we do on a periodic basis with all of the students in the cohort. So I can say for certainty that there are conversations going on, there's networking going on. I can't give you examples just at the moment of how that might have translated into somebody getting a new job or advancing in their career in a given job. I don't know if Paul might have some thoughts on that, but again, we're We're only about a year plus into this, so we do believe and have a lot of reason to think that this kind of networking, along with the course content and the skill building and integrating this work, will actually give you both the skills and knowledge and the contacts and connections to be able to advance your career in humanitarian health.
Yeah, perhaps I would just add that what we've noticed so far, and it is early days, is that amongst all of the students, there often are a certain amount that really do get work amongst themselves. Some of them have met. We've met with them, and they've been in Washington, D.C. or in Baltimore, or when Court and I are traveling somewhere, we can meet some students if we happen to be in those areas. But also, there are many students that have contacted us, and I've had, and I'm sure Court has too, numerous discussions about what they're planning to do, some of our contacts, career advice, etc. So I think the answer is yes, for sure. And some of it is incumbent on Court and myself, and then the faculty, and some of it is also really important for you to be able to reach out amongst yourselves. The other thing that we've been doing more and more now is having students, we didn't do this the first year, but having students themselves in some of our live talks talk a little bit about what they've been doing, those that are in the field or have recently been in the field, which I think allows everyone to get a lot closer and understand each other.
Wonderful, thank you. So a couple of admissions questions came in that I'm happy to answer. One question was whether a GRE is required, and good news, we do not require the GRE. The other question is about how long does it take for review once an application is complete. So that does depend a little bit. Our review committee, like I mentioned, does rolling admissions, so they do review as applications come in. So it does just depends a little bit on travel schedules, things like that, but typically we would expect around a month for an admissions decision to be rendered. Another question, what is the difference between this and an MPH that might offer humanitarian focus?
I'll try to field that. The MPH is a professional degree. It's a research-oriented degree. It has a long-standing track record in, of course, the field of public health. In fact, I think Hopkins, if memory serves, was the first to offer the MPH in the United States, and may well have even come close to inventing the thing. So I would say it's typically been seen more as a degree that somebody with clinical skills, an MD and RN coming out of a health services background would take on to learn more of the research and practice of public health. That has evolved so that we have many students coming in doing MPHs who come out of NGO work. They could be health and human rights. They could be doing work on gender-based violence, whether in a humanitarian setting or not, and want to build the research and practice skills relating to public health and seek the MPH. It's harder to kind of parse the difference between exactly what an MPH is and what an MAS is or is not. I would come back to that keyword applied that Paul talked about earlier. The students that we think will be looking to do this degree and will come out and be able to utilize this degree are ones who really want to apply their skills in field settings. That could be in the United States, working with refugees and new immigrant populations, could be overseas, working in humanitarian crises, could be in international organizations, governmental entities, or non-governmental. So we really see the applied, the MAS really much more focusing on practice and building professional skills to engage in applied humanitarian health work. Paul, you want to add anything to that?
Nope, I think that's a good description.
Great, thank you. I do just want to pause for a moment to let our attendees know we have a ton of great questions coming in, which we love. I'm guessing we may not get to all of them since we're about 5 minutes away from our ending time. So if we do not answer your question live on the broadcast tonight, one of our admissions team members will reach out to you within the next few days to answer your questions personally, and then we can always reconnect with Paul and Court if we find that we need additional input from them on your questions too.
If the program doesn't automatically cut off, I'm okay to stay for another 5 minutes, but I don't know if it's automatically stops at 7:30.
So as I mentioned, we expect to get some questions on work experience, and we do have a few coming in. I'm going to ask a more general work experience question that we received, and if you are writing in with questions about your specific experience, we'll probably connect with you in the coming days. So broadly, could you describe some types of experience that would be really beneficial to see in someone's application package?
Go ahead, Court.
Yeah, okay. So I mentioned a couple, and I'm just thinking about some of the recent applications we've reviewed. So somebody may be working in refugee resettlement programs or working with new immigrant populations. One was working along the border, the U.S.-Mexico border, doing work with children in detention, I think also doing some advocacy work. They may be people working, I'm thinking mostly about NGO work in a health-related non-governmental organization, again, possibly the United States or overseas, maybe with the organizations we've mentioned, Médecins Sans Frontières, International Rescue Committee, Save the Children, or perhaps working with a community-based organization. I would say that we take the issue of public health experience fairly and apply it fairly broadly. Certainly does not need to involve work in any health services related entity, and certainly does not involve or require clinical skills. It could involve clinical skills with some application at the population level, but really it's a fairly broad array of potential experiences we're looking for. And I would say this doesn't quite answer the question, but if you're thinking about the degree and you want to sort of send us an email and say, this is the kind of background I have, do you think that's the kind of experience that would be considered both relevant and consistent with our admissions criteria? And the answer we would give would not be explicitly, yes, you're in, but yes, that's the kind of background, or perhaps in some cases, no, and here's some ways you might want to enhance that through some additional work experience.
I could maybe add a little bit, just thinking a bit about, and Court and I have discussed this a lot, but ideally we would love to have people that have worked in the field, but there are certainly many people that have experience. They've been working nationally, it may be in the States or in wherever they're from, working with their Red Cross or Red Crescent societies or the disaster management societies. I would say one thing, though, because we've gotten this a lot, is that this course is really meant for international work and humanitarian work. So if your longer term goal is to become an expert in disaster response in the United States, this may not be you still learn something, but this would not be really the course for you. It really is meant to be humanitarian, primarily in low and middle income countries. So I think that's important. But we've accepted people who really want to better understand this field, are very interested in humanitarian. Some have had clinical work, some have been psychologists, and others who have just really interested and have traveled a lot abroad and worked abroad a little bit here or there, but don't have exactly the in-field experience that we had been expecting. But so we can be quite flexible, I would say, in this, but I think what's most important is the expectations that you're going to be coming away from, and it's a meant to be humanitarian emergencies in low and middle income countries with a very strong focus on conflict and displacement. We do also have a fair bit on natural disasters, and we also have a fair bit on disease outbreaks such as Ebola or cholera as well.
Thank you, I appreciate it. And just since you were just talking about the international focus of the program, we did have a question come in about whether you need to live in a lower middle income country to complete the program. And the answer is no. So you do need to reside in an LMIC to apply for the CHH scholarship funding, but not to apply for the program.
And in fact, probably the majority of our applicants are still in the States, but we are expanding, and we really want both because we think it's really important and also enriches everyone's experience to have a really diverse group of students. So this year we have a very nice mixture of those from people from Africa, from people from the Middle East, as well as from North America and some in Europe.
Wonderful, thank you. One other question that came in, which I'm happy to help with, or you all can chime in as well. Are applicants able to connect with current students regarding their experience? So, Court or Paul, do you want to answer that, or would you like me to chime in?
Again, this is just one cohort in, so they're talking to each other. We haven't yet had students, to my knowledge, talk to prospective applicants, although absolutely we would encourage that. We do that all the time with other degree programs. So yes, we would very much encourage that and would try as much as we can to facilitate that.
Yeah, I would just echo that we wouldn't do that without obviously asking the students ahead of time, but
right.
I know many, we know many of the students, and I have had actually one or two people I've given names to other students. So the answer is yes, we can do that. We just need to do it in a deliberative fashion, but I think that would be very important.
Absolutely, and in some of our other OPAL programs, we definitely like to make those connections as well. So you can see contact info on the screen. If you are interested in hearing from a current student, go ahead and just shoot an email over to the address on the screen there. Or if you're already working with an admissions officer, you can feel free to ask them as well. It does just take a little time because, as Court and Paul mentioned, we want to get authorization from the current student, coordinate contact information, things like that. But we do love to make those connections for you, and absolutely it's a really beneficial way to learn more about the program. So it looks like the remainder of questions that are coming in are probably pretty specific to some of our candidates. So if you ask a question that hasn't been answered, like I mentioned, we will be reaching out to you. But I think it looks like we're going to wrap up on the bulk of the questions here. So I do just want to say thank you to everyone who attended. We're really looking forward to working with you throughout the application process. And Paul and Court, I'd like to let both of you kind of bid farewell to our attendees tonight. So Paul, can we start with you?
Sure. This is a serious decision, anyone that wants to do this, because it's a lot of work. So we want to make sure that you understand the program and what it's about and its goals. And I know that Court and I would also, if you have some specifics, it may be hard to speak to everyone, but we can either do it via email. But we want to make sure that you understand what this program is, and we also want to make sure that you're a good fit. And we welcome any questions in the future.
Yeah, I would just add to say it was wonderful to be able to engage with you. Obviously, it's a little bit one way. We're not hearing your voices. You're hearing a lot of ours. But we do want to personalize this in any way we can. So please do reach out with email questions or comments or requests to contact us. And as Paul said, we may not be able to promise every single person gets a personal call back, but we will do the very best we can to talk with you. This is a serious decision you have to make. There's time and money involved. We we do believe that degree program is worth it, but we want to make sure that you feel it's right for you, and obviously we feel you're right for us, and that we can work together productively. Thank you.
Great. Thank you both so much for joining tonight and sharing information about the program. And to all of our attendees, we appreciate you coming on as well. Hope you have a great evening.
Thanks, everyone. Bye-bye.
Bye all.